Hello, welcome to the Wellbeing Matters. Dietitian Adaeze Obi. I'm so happy to have you.
Thank
Today we are going to be diving into a very, very important topic and sharing your expertise with our community members. So we appreciate you coming on board and joining us here at the Wellbeing Matters. Thank you.
thank you. Thank you so much, Dr. Mary. Thank you for
Yeah.
having me. It's a pleasure.
Okay. So let's know more about dietitian Adaeze before she gives us all the juicy parts of our work. Um, Dietitian Adaeze is a UK-based registered dietitian and nutritionist, and she has experience in supporting individuals to improve their physical and mental well-being true evidence-based nutritional intervention. She's not just a dietitian, but she has specialty in mental health management with nutrition therapy. And she has worked in both clinical and community settings, collaborating with various teams multidisciplinary, especially to deliver holistic care. So today, Dietitian Adaeze is not just going to be wearing a dietitian hat, but she's here with compassion, people-centered approach to share with us and empower us as a community to ensure we achieve a sustainable, healthy lifestyle. And that's what we are all about. So thank you once again. I shall be giving us insight using evidence-based findings, up-to-date research to ensure that we have options based on our nutritional counsel and information that are culturally appropriate to our community members. So thank you once again for joining us today, Dietitian Adaeze.
Thank you for having me, Dr. Mary. Thank you so much.
Appreciate you joining us. So our first question to our guest today is, let her tell us a little more about herself in her own words, and also let us know who you are and fun fact about you.
Okay, thank you so much for that question, Dr. Mary. So as you have rightly said, I am Adaeze Obi. I am practicing currently in the United Kingdom. I qualified back home in Nigeria as a dietitian. So prior to moving to the United Kingdom, I I was doing some practice as a dietitian as well. So I have some experience managing a number of clients with certain disease conditions over there. And then moving over here, I started out working in the acute setting as well. But currently now I'm specializing in mental health and dietetics. So I'm a mom, I'm a wife, I am someone who loves her space, who loves to spend time, resting when she's not busy with taking care of family. I love to read. I love to take walks.
Awesome.
Yeah. So that's
Thank
about
you.
it.
You're talking about
Yeah.
mental health. So I think it's a given we have you not just sharing your experience, but sharing your personality with us. So thank you.
Yeah. Okay.
So tell us about personal health goals and how nutrition can help people stay motivated to achieve their health goals. Generally first, and then we'll move on to the nutrition specific ones.
Okay. Thank you. So, personal health goals. The word personal there already makes it individualized. That is to
Mhm.
say, no two people will likely have the same personal health goals, the same aim that they want to achieve health wise. And that's because it's possible that Mr. A may have an underlying health condition and Mr. B may have something totally different, or Mr. C is just someone who has no underlying health condition, but wants to live a lifestyle that continues to maintain that health condition. So it's very different for different individuals, and it also has to do with the underlying health conditions, if there are any, about any health conditions that A, B, or C is going through. Yeah.
So thank you for saying that, Mr. A and Mr. B, the analogy, it's really relatable. And so when we move to nutrition specific, personal health goals, nutrition goals need to be more precise in terms of
Yeah.
looking at the individual factors and also their health
Okay.
variables. So I really appreciate that, giving us upfront that no two persons are equal, you know.
Yeah. Yeah.
So understanding that fact, let's build on it, on
Okay.
why do people talk about their diet plan failing, or they can't stick to it even when they have some goals, and
Yeah.
also the nutrition plan might be there, but they're like, I'm struggling, I'm just struggling to
Yeah.
meet.
Yeah.
Why do you think we struggle with that? And based on your expertise, what can you say?
My years of experience, there are a number of reasons that I've seen that causes people's diet plans to, very intelligently curated diet plans that, it turns out that the patients are not adhering to it or not complying to it. And few of the reasons that I've seen, first of all, it could be the way the diet plans were arrived at in the first place. So um, during the course of getting the patients, or the course of seeing a patient, as for instance, as a dietitian, for instance, you go through a process of assessing the patient, and there's a whole lot there. You go through the anthropometry, the biochemical findings, the clinical reports, diet history, environmental and social history, and all of that. That then builds up to you coming up with a nutrition diagnosis, and then it follows on to you coming up with a nutrition intervention plan. Sometimes what happens is that if a generic structure is followed and a diet plan is arrived at, that is good. It looks good. It looks well thought out. It looks very structured, but doesn't, you know, take into cognizance the specific, unique characteristics of a patient. They may not likely progress with the compliance with it. For instance, a diet plan that is not culturally sensitive um, may be very impossible or very difficult to keep to if you're seeing a person of African descent in a clinic and you then go on to create a diet plan for the person that then includes meals that the person is not used to. That's already a diet plan that is set up to fail.
I know, right?
Or or a diet plan that is economically unrealistic.
Mm-hmm.
You know, you put things on there that is good. It's good for, it's good for the eyes. You see it and like, oh my God, this looks very, very good, very structured, but the person does not then have the economic power, the economic ability to be able to afford the things that on that diet plan is definitely set up to fail. Another issue that also comes up is that poor timing. Poor timing is a thing as well, because that a patient turns up in a clinic and you know shows interest in changing their diet and all of that, or putting up steps nutrition wise in order to get to a certain health goal, does not necessarily mean that they are actually ready. And sometimes if our approach is not one that involves the skill of motivational interviewing, there's a skill called motivational interviewing that, enables you to prompt the client or the patient or the service user to, go ahead to instigate or sort of like come up with strategies themselves that helps in line with their health goals. Sometimes it doesn't work because when motivational interviewing skills are deployed appropriately and these clients then, sell, they problem solve themselves. They tell you the steps that they are willing to take rather than you putting it on them. It works well. So in clinic, instead of saying things like, for instance, okay, this is a diet plan that is going to help you. or something like that. You can, deploy a skill of sort of asking. The research says that so and so helps with this and that. In view of all this, do you think that this is something that you're ready to do now? And if this is something you're ready to do now, can you go ahead to set so and so goals, and can we work together with this? So the whole idea I'm saying is that readiness that is also fueled by prompting them to problem solve, to take that initiative, to be the lead in themselves, in order to, come up with a meal plan by themselves. So I've said culturally insensitive, economically unrealistic, wrong timing, generic meal plans. You can't do a generic meal plan for everybody. People's needs are different. So it has to be individualized. It has to take into cognizance their cultural,
Yeah.
descent and all of
Yeah.
that.
What you said, I want to also bring it back to knowing your calories, about people not just saying, I'm told to eat this and eat that, and I will just eat
Mm,
that.
mm,
You gave an example of structured meal plan, but not having like the economical value, but also not also getting enough interest. When you said interest, I was thinking of intrinsic and extrinsic factors. People that are externally motivated by people is good, but if you are internally
yes.
motivated, that I own this choice, I own
Yeah.
this
Exactly.
goal, it kind of help you know that I'm accountable. Then,
Yes,
oh,
that's
they
it.
asked me to do it, I don't want to do it. So, in the aspect of fueling our body wisely, it's not just about getting the plan
No.
and knowing what to eat. Is about how to do it and how to
Yes.
achieve those goals from what you've said. So, thank you for sharing that insight. Thank you.
Thank you.
Moving on to our next question, and I want you to give us more nuances based on your experience here. We talk
Yeah.
about know your calories. I've been talking about Know Your Calories series with my community. And
Okay.
in the series, we've delved into what is a calorie, the requirements you need to have, benefit of eating healthy. Let's move on to how metabolism, mental health also keep us accountable in terms of what we need to eat. When I mean keep us accountable, how do we consider what we are eating and our metabolic health and ensuring that we stay on course? So we are not starting something today and we are thinking of a quick fix syndrome, and then we stop and then we come back to it and say, oh, we are not seeing results. How does that work, and how can that affect us as individuals?
So it is a very pertinent question because it is what we see in my practice as a mental health dietitian. We see a lot of links. There are a whole lot of links um, with the physiological functioning of the body, physiology of the body, and as well as, the psychological functioning of the body as well. So um, I'll just simply summarize everything I want to say based on the findings from a study that
Hmm.
was done between 1944 and 1946 in the University of Minnesota. So that's a paper you can also share with your community members for those who want to explore further and read up more, because the most I can do now is to just give a summary of it. So basically, the study was on starvation syndrome. So what that
Mhm.
study looked to do was to find out how undernourishing the body can affect the mental state and the physical state of an individual.
Hmm.
So that study recruited, I think it was about 30 male, healthy male,
Hmm.
and for 3 months they were fed normal diet based on their calorie requirements. The next 6 months, their calorie intake was reduced by 50%. Bear in mind, I said just 50%. And then the next 3 months, they were then refed based on their normal calorie requirements. And the findings from that study is mind blowing as to how these affects, the mental state as well as the physiological changes
Hmm.
as well. And I'll just highlight a few. So, starvation syndrome occurs when the body is undernourished or irregularly nourished. And in my practice, we often see that in the case of disordered eating or eating disorders. So, eating
Hmm.
disorders when a person extensively restricts their diet, or even when they eat, they then go on to, engage in compensatory behaviors like purging and all of that. So the body does not have that regular boost of nourishment based on its requirements. So what that study actually brought out was that, first of all, the physical changes are very clear. So when the body does not have a regular boost of nourishment, what the body does is that it then prioritizes life sustaining activities. So the energy requirement, because just for us to be at rest, the body burns energy.
Yeah, calories are going
Yes,
off.
the body burns energy just for us to have our lungs collapsing, expanding, collapsing, that action of the lungs that keeps us breathing, the pumping of the heart, you know. So those are, those baseline activities to keep us alive. The body needs energy to do that. And when our energy supply is deficient, the body prioritizes those activities, those life sustaining activities, and then it shuts down on all other processes that require energy. So, for instance, our brain is nourished by energy. So, aside from the physiological changes that we can see in the body, like I think the study revealed that about 25% of heart muscle decreases. Of course, there's weight loss, there's lean body mass loss, and all of that. That's the body trying to, you know, I'm just gonna I'm just going to shed off. I'm just going to shed off to be able to
Mm-hmm.
gather the energy I need in order to keep you alive. So the body is in that mode. That's just physiological. Psychologically, it's amazing to see that changes in thinking. So that study actually brought out that for those normal, healthy men who then entered into the second phase of the study, where just 50% of their calorie requirements were reduced, their thinking changed. So that ability to problem solve,
Mm-hmm.
that
Wow,
ability to concentrate, yes,
it's
that
affected by what we eat.
yes, it's affected by what we eat. It's affected that ability to concentrate, that ability to be socially, socially optimized, behaving well, that your thoughts, your thought process, your decision making, problem solving skills, cognitive abilities, they were significantly affected in these people who had their their calorie intake reduced by 50%. And that's what we see in our practice. That is why the recommendations are that whenever we have an eating disorder patient, especially for a patient who has had their energy, their calorie requirements severely restricted, the recommendations are that we focus first on refeeding this individual. We need to bring them to a certain state of nourishment, because we know that when they are nourished to a certain level, the brain then has that boost, that energy it needs to engage in psychological therapy. Amazing, amazing stuff. Because the body, it's so mind boggling to see that how we eat, how we nourish. So even if it's a case of you reducing your calorie intake by 50%, it may not be eating disorder in some cases, but the mere fact that the body does not have that regular boost of nourishment, okay, it can make you not be optimized psychologically, and that can also affect your metabolic processes as well.
Because when we talk about know your calories, and I try to tell people it's not just about weight loss, it's not just about strict calorie counting, it's about healthy living.
Yeah.
Fueling our body wisely is important. we need to know
Yeah.
that there are consequences for our actions, not just
Yeah.
in behaviors, but in what we eat. The
Yeah.
study done in Minnesota actually shows that even with 50% reduction in your calorie, it can affect your psychological functioning.
Yeah.
And so, why do you reduce calorie if there is no health provider recommendation, if there
Yeah.
is no need
Yeah.
to go on strict punishment for not
Yes.
eating? I call it punishment because you need your food to thrive.
Of course.
You
Of course.
need your food to thrive. So thank you, dietitian.
Yeah.
I appreciate that. So let's move on. What would you advise a woman, especially in this day and age where we have people juggling career, family responsibility, and also trying to ensure the household is well fed, and the woman holding on to, I'm too busy to eat.
Mm-hmm.
We have that a lot of questions, and I have some community members tell me, "Oh, we're so busy," and I'm like, "Well, be moms, you can do better." But how can we ensure that we prioritize our feeding?
Yeah. Thank you so much for that question. I mean, I'm not, I'm also in that shoes where I need to also consistently remind myself that, you know, I can only pour from a cup that is full. Yeah. As a young mom of two lovely boys, I understand what it means like to get up in the morning and you know that you have to hold it down for every member of the family. You have to serve. Okay.
Uh,
It's a blessing. It's such a privilege to
hmm,
it will help us slow down. Okay. It will help us slow down because um I sometimes think to myself, when I'm not, for instance, when I'm down health wise, maybe an episode of flu or something like that. The primary reason why I'm not happy is not anything far from the fact that I'm not at my best for
but
my
for your,
family.
yeah.
Yes. It's not that I'm not my best for my family. So if you now extrapolate, just stretch that thought a bit further.
Mm-hmm.
Imagine if it now turns out being something more complex, a more complex health condition that results as a due to self-neglect in quote or not really taking care of yourself so well. Motherhood is a privilege. Wifehood, it's a privilege. It's a call to serve. It's a call to cater to the needs of everyone. Our physiological makeup, it's one that we're created to serve.
Yeah.
Okay. So we need to embrace that our calling to serve. However, I find that while we don't hesitate to embrace our calling to serve or that that responsibility to serve, sometimes we also forget that um the person who serves also needs to be taken care of as well. So practical tips I will share is number one, we need to get our perspectives right. We need to get our perspectives right because when we understand that we cannot pour from an empty cup,
Mm-hmm.
imagine how that can deprive me of the opportunity to care for the people that I really want to see thriving. So getting our perspective right, we need to take care of ourselves if we want to be on the scene longer. If you want to be on the scene, more present on the scene even while we're there. So we have to take care of ourselves. We have to take a pause and say, what are the things that I need to do for myself in order to be optimized health wise? So if that means ensuring that maybe when the kids are having breakfast, you also steal that moment to have something put, into your stomach as well. Brilliant. If that means ensuring that before you're dashing out for work, you're ensuring that it's not just the kids that get a packed lunch, you also pack something for yourself.
Yeah.
Yes. If that means ensuring that the things that you love to eat, You also make sure that whenever you're going grocery shopping and you're trying to get the things that your husband or your children or the people living with you love, you also prioritize your own needs and ensure that the things that you love eating are there. So basically, what I'm saying is you need to sit down and have a conversation with yourself to say, my health is also important, because if I really want to keep on
Wow.
serving these people that I love,
Mm-hmm. Yeah.
I need to be at my optimum in order to serve them for longer and well.
Yeah. Thank
Yeah.
you. Thank you. That was packed. Even for me, you know, I'm like, I'm walking, I'm doing this. I want my baby girl, I have a daughter, and I want her to be optimized in terms of what she needs to eat, what she needs to learn, prepping for the week. But do I prep for myself?
Yeah. That's
Do
that's it.
I? Yeah. And it takes thoughtfulness or mindfulness, and
Mm,
also trying to see how to ensure that you're not just eating once a day, but eating sustainably. I close my eyes there because I'm a nutritionist. Are you guilty of not eating consistently?
yeah.
So
No.
mood cravings, and as women, we have different cycle in the month, and we need to
Mm,
ensure that we are well optimized. Our metabolism is not just zigzag. And give us some practical tips to address energy dip or
mm,
mood swings or cravings. I know
yeah.
craving food is another thing. I think I should not model that up with this question of how do we achieve sustaining our energy throughout the day with what we eat, practical tips, and then we come to food cravings later.
Thank you for that question. Also, um, basically, recommendations have it that when we try to nourish ourselves by having three main meals a day with healthy snacks or snacks in between, it helps the body with respect to releasing the energy that it needs to get us through the day. So that may be a good place for someone to start with. Sometimes it's not, will I say, it's not practical, or it's a bit off routine for us to have three meals a day with snacks in between. But trying that has a way of ensuring that we have that regular boost of energy throughout the day. And it also helps with binge eating, because sometimes when we have not had something to eat for, let's say, the most part of the day, we then find out that sometimes when we're now coming to have maybe lunch or the last meal of the day, we then tend to pack our plates full because we feel like we need to make up for
What
the
not
meals
getting?
that we have not lost, and that, of course, sometimes that leads to things like, I mean, maybe weight gain, unintentional weight gain, and all of that, and other health conditions that can result from that. So, what I would recommend is three meals a day, snacks in between. Of course, bearing in mind that people have different health conditions that you may need to intentionally do certain things about. Like, for instance, if you're diabetic, type 1, type 2, you may be intentional about the kind of snacks and all of that you're having. And if you're on medications, to ensure that everything is well planned in and panned out. But basically, three meals a day, it's fantastic with managing energy dips and all of that. It keeps things in check, and it helps you, avoid, behaviors like binge eating and all of that could result from it. Yeah.
What do you think my community members or anyone watching us can
Yeah.
do to reduce or not even crave food? Not pregnant mothers, sometimes they can have some cravings.
Yeah. It depends on what the cravings are. I think everybody should have a craving based on, and sometimes
Yeah.
cravings are linked to sometimes the memories,
Mm-hmm.
sometimes um memories, physical memories, sometimes it's also taste memories. So it depends on
Mm-hmm.
what the cravings are. Good
Okay.
cravings, good cravings that have to do with food, not unhealthy, definitely unhealthy substances, maybe
Mm-hmm.
alcohol or drugs and all of that. We're
Yeah.
speaking food here. I know that probably what may be on your mind, maybe, maybe foods that are considered unhealthy. Okay,
Ultra
maybe like the
processed food,
ultra processed food, all those pastries, calorie dense and fat
those
dense,
sweetened things.
those sweetened things and all of that. You know, what I would say is yes, there are recommendations that don't really recommendations are out there that these things are unhealthy, and it's true. The research findings have shown that consumption of these ultra processed foods or
Mm-hmm.
calorie dense sweetened foods, high fatty foods and all of that, they are linked with a number of nutrition related non-communicable diseases.
Yeah, I
Yeah,
agree.
very true. However, what we often say is that these things can be had in moderation. It's possible to have a little bit of these things without necessarily over restricting on them, if you get what I mean. So strategies that we could use to encourage people to maybe have a little bit of these things that interest you, maybe like pastries and all of that, and the ultra processed foods like, let's say, noodles, for instance, and all of that, is we could say, if this is a craving that you feel that you are trying to manage at this time, what we recommend is planning for them. You can plan ahead for these cravings, sort of like saying to yourself, is there is there something that tends to trigger my want for this? Does this come at a certain time? And can I be intentional about saying, oh, I can predict that this is something that I will crave? Is it possible that I plan ahead for it? So it could be, for instance, fizzy drinks. I do that for
Hmm.
myself. Fizzy drinks, just sometimes that I come back, I just want a very chilled bottle of maybe one of those fizzy drinks. I don't want to call a name now. One of those fizzy drinks. I find that actually that when I take a glass of very cold water and just wait for a few minutes, that craving I have for fizzy drink, it dies down. So these are things that can be done. If you have a craving that makes you want to eat a whole bag of, what's that, crisps, we call it crisps here, or all those things like maybe cheese balls and all, one of all those things in that category, it could
Potato
be that
chips.
potato chips or something like that, crepes, blah blah blah, all of that. You can be intentional about saying, okay, I know I'm going to have, and my body is going to want some of this. Is it possible that I know that I'm going to have this, and I'm conscious about saying this is the quantity I am going to have? So that's what we also say, like, plan for them. And in that vein also, we can also say, when you also plan to have these things, it's okay to have maybe a little of it, but can you also substitute that with something healthier? One of the
Hmm.
things that we also recommend is your food environment. What's your food environment like back home?
Yeah.
Because sometimes they may be the things fueling those cravings. So bear in mind, I've said things like, you know, we may not really say cut out all the cravings immediately. So the strategy will be, how can we get you to plan ahead for them? How can we get you to change change your food environment? Because basically, if you're craving something by 11 p.m. or
Hmm.
12 a.m. in the night, best believe it is what is in the
Yeah,
house that you're
I
going to
agree.
run looking for.
I
But you can
agree.
imagine, yes, imagine if your food environment, you have intentionally curated it in a sense that you say, okay, I'm just going to put this and this and this here, so that by the time I'm getting up, I know I tend to get up by 11 p.m. Maybe when I'm Netflixing or something like that, I tend to look for something to snack on.
Okay.
Is it possible that I put this and this here, so that when I get up, these are the only alternatives I have, and then I
Mm-hmm.
get that? So plan for them and change your food environment. Yeah, that's what I would say.
Wow, wow, wow. Really love this. I appreciate your insights and I appreciate you giving us practical tips for managing food cravings. Now, reiterating what you've said, Can we deal with food cravings? Sure.
Yeah.
Can we eradicate it totally? Not necessarily, because we are humans.
Yes.
And if we know that we cannot eradicate food cravings, we need to put practical steps in place, smart goals,
Definitely. Yeah.
achievable. And that is what you've told us. I hope,
Yeah. Yeah.
I
That's
believe
it. Yeah.
we hold on to that. So before we go and give us the final words in terms of how to fuel our body wisely, can you share a little bit of how your journey into mental health space has been and why you think this field is so important in relating it to dietary intake and lifestyle? We tend not to think holistically before, but you're doing that. You're working
Yeah.
in a multidisciplinary team as a
Mhm.
registered dietitian providing
Yeah.
nutrition and mental health services. Tell
Yeah.
us more. Let us learn.
Yeah. Thank you so much, Dr. Mary. This question just cast my mind back on one of the courses that we learned while I was in uni. It's nutrition in the life cycle, and you know, it just it just basically exposed our minds to the fact that at our very core, food is our building block. So from when a woman conceives and she's carrying a fetus in her womb,
Mm-hmm.
and that fetus continues to grow and grow and grow, and in the course of 9 months, it forms into a full-fledged human being who then, comes out at the end of the gestation period. Nourishment is very key. And that's why the whole buzz is around take care of what you're eating. Are you taking your supplements? Are you taking your vitamins? Ensure that you take this and that and eat healthy. Don't smoke. Don't do this. Don't take certain drugs. Are you on certain medications? Let's be sure that it's good for the baby and all of that. That's not just a force. All those things are put in place because actually what that baby goes on to become even later in life, some of the things are programmed by what the mother eats, by the food environment that the mother exposes that baby to in utero. There's a reason why I'm starting with that because I want us to really understand. Sometimes we're not really mindful in that sense because we don't really know the import of of the things that we do, and sometimes it takes us just sitting back to actually really reflect and say, how important is this? So starting with that, I just wanted to put that foundation out there that at our very core, we are made
Mm-hmm.
up of food. So how good we have come out is because, you know, someone fed us right when we were in
Mm.
their womb. Okay.
Yeah.
So, and that
Yes.
doesn't just stop there. So a child then grows up from birth to the first 5 years of life. A number of things are going on. The brain is forming, certain vital organs are developing rapidly. And that's why when you hear nutritionists and health experts in the public health space talking about, the well-being and the health and the development of children under the age of 5, from birth to the age of 5, they actually refer it as a key window of opportunity to be able to nourish them in a way that sets the foundation for all other life processes, cognitive abilities, because that's when the brain is developing as well, and all of that. And the body is growing, the organs are, getting that their final foundation sorted out. Sorry, I'm saying it in a layman term and all of that. So that's very important because the way you nourish your body matters. So back to the question that you asked, nourishing our bodies is very, very vital because based on what I shared earlier about the starvation syndrome, we could already see that how we eat affects the way our body processes, information. Your brain doesn't function at its optimum when your calorie intake is suboptimal. Your body prioritizes, life sustaining activities when your calorie intake is suboptimal. It just is keen about keeping you alive and well. So basically, it's for us to be mindful, it's for us to be conscious, to know that what we eat goes a long way to determine how well our body functions. It goes well to determine how our mental state is, how that brain, our brain's ability to be able to make decisions, to be able to, problem solve, to be able to, coordinate cognitive functions that it needs to actually, that you need, that I need to actually be a human being who thrives at her place of work. So what I would say, the journey has been it's been a brilliant one, coming from an acute space, working with patients with a number of health conditions in a typical hospital environment, and then coming into a mental health setting where our key input in a patient's journey to complete well-being has to do with psychotherapy around nutrition, letting them see that what you eat matters. The way you're feeling now, the way you're feeling very listless, you're not interested in life, you're very discouraged. These are the effects of starvation syndrome. And you will notice that when you intentionally feed your body regularly, we tell them you don't have to. You don't have to actually depend on hunger cues because your body does not prioritize hunger, giving you those hunger cues at that time. The body does not have those that, so when the body is prioritizing life sustaining activities, there are a number of things that shut down. One of all those things is that the hormonal process that tells you when you're hungry is shut down as well. So we often say, don't listen to hunger cues. Give yourself a regular boost of nourishment. Over time, your body
Mm-hmm.
then has that energy that it needs to now wake up certain hormonal processes that it should be, on a normal day alive to. So basically, that's psychotherapy. We let them see how what you eat affects your reasoning. So the reason why you're listless, you probably are not wanting to, see the fun side of life or the joyful part of life, anything worth living up to, is because you probably don't have that capacity to process those higher thoughts. So why don't you give yourself a regular boost of nutrition and let's see how that works. And studies have shown that it works brilliantly. It works brilliantly. Yeah.
Awesome, awesome. You can't deprive your body of the needed calories that will make you see the beautiful side of life and you think you will function optimally.
Yeah.
Foiling our body wisely, like you said, it's important. Starvation syndrome. You know when a person is not eating well, not thinking about, okay, I have a dream. I have
Yeah.
this. You're
That's
only
it.
thinking of breathing, sleeping, waking up,
Yes. Yes.
going to the bathroom, coming back. No goals
Yes.
for today or
Yes.
goals for
That's it.
tomorrow.
Even
You
if they
lose
had
the
goals,
drive. Yeah,
they don't have the capacity to be able to process, okay, because it doesn't just stop at goal setting. Is so what are the steps that I need to take and how can I then have the
achieve
grit,
it.
the tenacity, the determination? All these things take energy, takes mental capacity, mental fortitude.
And
So when
glucose
you're
is
listening,
needed for
yes,
the brain.
yes, and glucose is needed for the brain. So
Yeah, thank you,
Ariki, yeah,
Dietitian Adaeze.
yeah. I
Thank you
was going to
so
say
much.
you can kindly refer them to that article because I only scratched the surface of it. There's a whole lot there that I have not mentioned, but basically I just gave a summary of what that article
Thank you.
found
Thank
out.
you.
Yeah.
Can you share the title of the study, or even if you have a link to the paper, I'll download it and share.
Yes, I will. I
Thank
will
you.
share it with you.
Thank you. So we've come to the end of our conversation today on For Your Body Wisely, nutrition and mental health, and more importantly, feeding your body to thrive. We are not just saying food is something that you need to eat and sleep and wake up. Food is important to make you function optimally. She used the word I am functioning. What does that mean? To make you optimize your health, optimize your life, optimize your goals, your career, and take the next needed step to achieve that. So please, fuel your body wisely. Eat nutrient dense food. Also prioritize timing. Look out for the internal factors that can make you achieve your goals. Be accountable. We have a community for you. Learn from experts. It's important. Not strict calorie counting. And if you have other questions, send them across. And if you want to speak to our guest, you can let me know. She's working fully, but she can answer some of our questions that may be specific to the conversation today, or you want to also ask something regarding mental health and your nutrition, lifestyle, or also trying to balance motherhood, family, nutrition, health, goals, you can reach out to us. But till next time, thank you for joining the Wellbeing Matters. Have a good day. Bye.